Oh, I'm sorry. She's back at the microphone. She gets precedence.
Walked all the way back here. Could you comment about some of the studies that are out in the lay press now, like magazines and newspapers, about the fact they don't think that Aricept really does much to help with Alzheimer's?
Okay. Does Aricept really help in Alzheimer's? Yes, I think it does. There's all kinds of stuff in the lay press these days about Alzheimer's, and a lot of it is just hype. Scientists have learned how to hype their work. You know, it's a really, I think, unfortunate, but they have. We now have press agents. Every place has their own, every medical school has their own media department that gets these things out, and they have learned to hype this, that, and the other. So Aricept, I think, clearly works. There are dozens of studies that show that it does have a benefit. But if you're asking the question, does it halt Alzheimer's disease? Absolutely not. Does it address the fundamental underlying thing that's causing the brain to die in Alzheimer's? Absolutely not. Do you have to take it early enough? I personally don't think so. There is some evidence that would suggest it would be helpful, but I don't think so. I think it improves cognitive function. It does not change the underlying disease. Okay? Yes, sir. Or we'll go over here.
Sir, my question to you is I really appreciate your talk tonight, but I'd like to know where we can get some pamphlets or books that go into this subject. There's no material, written material.
Yeah, that's a good point. There is a book by a neurologist, young neurologist that I hired, Dr. Marwan Sabbagh, S-A-B-B-A-G-H. I hired him. He's a really good crackerjack neurologist. Wrote a book called The Alzheimer's Answer. It's full of a lot of pop stuff about what you can do for Alzheimer's disease, and I don't agree with about a lot of it, but I got a lot of time for Marwan. He's a really bright kid, and his book outsold mine by a lot. I published a book about 10 years ago. It's called Candle in Darkness, Current Research in Alzheimer's. Probably out of print, although I think Amazon still has a few dog-eared copies. It's 10 years old, but a lot of what I said still remains true after 10 years. After that, well, it would be Rudy Tanzi's program on mindfulness might bear looking at. You can also use something called PubMed to look up reviews of Alzheimer's disease. So PubMed's a really good thing everybody should know about. It's something the National Institutes of Health supports. It's done by the National Library of Medicine. And you can Google it up, PubMed. And then you go to PubMed. I'm sorry? P-U-B-M-E-D. P as in Paul, U, B as in boy, M-E-D. Okay? You Google it up and you go to PubMed and there's a window up here and you can type in marigolds and Alzheimer's disease and it'll pull up everything that was ever written about marigolds and Alzheimer's disease. And believe me, you will find at least one paper. Okay? I'm constantly amused when people get up and they say, well, Dr. Rogers, what about violins in Alzheimer's disease? I've heard that there's an important study showing there's a connection between violin playing and Alzheimer's disease. And there probably is. There are, I'm not kidding you, I just looked this up. There are right now 92,307 papers in reputable scientific journals about Alzheimer's disease. 92,307. Believe me, anything you want to find, you can find. So go to PubMed, type in Alzheimer's disease, then type in "and" in capital letters is Boolean, and then review. And it will, just start with the top ones because it will give you reviews. And look on there at the end of the citation, it will say free copy. And that means you can get a free copy. You just click on that, or you click on the citation, takes you to an abstract, then there's a little box, and you can get a copy of it for free. It will download it for you. Okay, it's very useful. Yes, sir.
Yeah,
I'm sorry, you have to go to the microphone. That's the rule.
Yeah, thank you for a terrific presentation.
Thank you.
My question is a little more scientific. Is there a known biological function for beta amyloid?
That's a great question. Is there a known biological function for amyloid beta peptide? Beta amyloid, A beta, we call it amyloid A beta. There's been lots and lots of speculation. I'm going to give you mine, because I know that one really well. Amyloid beta peptide is made by nerve cells, that's known. It's also made by another cell type in the body, platelets. Okay, platelets are in the blood, and platelets, their role in life is blood coagulation. So you cut yourself, the blood's got to coagulate, it's got to form a scab, et cetera, stop the bleeding. Platelets express beta amyloid when they're activated at sites of a wound, for example, and they spew out boatloads of amyloid when they do. Now, one of the things I know chemically about amyloid is it's remarkably sticky. It sticks to your test tubes, it's a big problem. It sticks to other molecules, another big problem. It sticks to itself and forms these gigantic fibrils. Fibrils, just the thing you need for a scab. Somebody once, my dad, in fact, looked at amyloid deposits in the Alzheimer's brain, and he said, it looks like a scab to me. And you know, I think he might be right. So I actually believe, and this is one of the things I hope to get to at some point, I believe that A beta is actually part of the coagulation cascade. And you could test that in a lot of different ways. For example, do people with mutations in the amyloid gene, do they have different clotting times? So it's something I want to look at, and it's a really good question. There are other people who've suggested that it might be a factor in regulation of complement, which is an inflammatory factor. There are people who've suggested that it might have something to do with growth of neurons. That's another possibility. Not really known for certain. Got to go back there. I'm sorry. I understand. Let's see, your turn. Yes, ma'am.
For early onset Alzheimer's, you said it's often genetic. Are there other risk factors or common factors that cause early onset?
No, the only one, to my knowledge, that causes early onset Alzheimer's, like in the 40s, is having a mutation in one of the amyloid genes, one of the genes related to amyloid. Yes.
Thank you for your nice presentation. And I'm Japanese, so I'm sorry for poor English. But I would like to ask, I understand the early diagnosis is important, but so the disease of Alzheimer is preventable, you mean?
It might be preventable. I don't think it's treatable, but I do think it might be preventable.
Preventable, you mean?
So there's data that inhibiting inflammation before you get to that age where you're going to have Alzheimer's may prevent Alzheimer's disease.
Okay.
We don't know that for certain.
So,
we just know it, but I would really like to do a clinical trial. It would just be so expensive. We tried to do one. It was too expensive.
I get it. So you said you can make a diagnosis exactly, almost all exactly.
The Holy Grail, one of the Holy Grails, is to find something that will allow you to make that early diagnosis. Brain imaging of amyloid pathology, that's one hope that we have, because amyloid, it's pretty clear, starts to develop about 20 years before you actually start to show symptoms. So that may be one thing that we will have. I'm working here at SRI on another diagnostic based on how amyloid is cleared out of the body. That's a possibility. There are many possibilities that are being explored right now as an early diagnostic.
So now, what is the definition of Alzheimer? Definition. What is the Alzheimer? What is?
What? I'm sorry?
Definitions.
What's the diagnostic definition of Alzheimer's disease?
Yeah.
So the definition of Alzheimer's disease is an autopsy definition. Okay. So you have to have been demented in life, and there are certain criteria for how demented you were. But the main criteria is when you look at the brain at autopsy, you have to see a criterion number of amyloid deposits per square millimeter and a criterion number of neurofibrillary tangles. That's the main one. And loss of synapses is another. Inflammation is another criterion. But the main one is number of amyloid plaques and number of neurofibrillary tangles.
Okay, I get it. Thank you so much.
Yes, sir. You got to the microphone. Good
I got
for you.
there. Yes, thank you. Thank you for a really, really interesting talk. I have a question about timing, and it sounds like there's 3 times. There's the onset of the deposits in your brain, and that occurs typically before you see any evidence of Alzheimer's.
Right.
And then there's the initial evidence of Alzheimer's, and the last timing is you die. Can you give us some idea of the time from T0 to
Yeah.
T2?
Yeah, very good question. So it is known from lots of studies that Alzheimer's pathology starts to develop well before you show overt symptoms. Okay. From the time that you are diagnosed with Alzheimer's disease, you have sufficiently overt symptoms to be diagnosed with Alzheimer's disease. You have on average 8.5 years, okay, between diagnosis and death. That's the average. There's a huge amount of variability. I've seen some patients go in 3 years. Typically, those with hereditary Alzheimer's disease go fastest. But even people without hereditary Alzheimer's, I've seen some go in 3 years. I interviewed a Methodist minister once who had been diagnosed 20 years ago with Alzheimer's disease, and he clearly had it, but he was still pretty functional after 20 years. So there's a great deal of variability, but on average, 8.5 years. Prognosis is not great. You start off just with memory loss, and it's not such a big deal as long as you can remember that you forget. Those first years of Alzheimer's disease really can be quite good. I've seen lots of very happy people who can still play bridge and get along great with their spouse, and it's not a bad time at all. The problem comes after about 3 or 4 years on average. These are just averages. When the person starts to forget that they forget. Okay? Now they start to think there's something wrong with you. Okay? You're treating me badly, and there's a lot of paranoia too that often develops. You're trying to get rid of me. And indeed, you need to be gotten rid of at this point. Okay? But if you want to do something good for a family with Alzheimer's disease, here's the time, because this is really rough on the caregivers. Okay? If you used to play golf with Joe, volunteer, go and take him out and play golf. Okay? It's astonishing, but muscle memory is not impaired at all in Alzheimer's disease until you get way late in the disease. Okay? Golf in particular in Sun City where I was, I mean, they're out there playing all the time if they can get a friend to go out with them. They don't keep score very well, but they probably didn't before either. So that's a service you can do. The caregiver needs some respite. And they also need to be helped getting over with the guilt of putting Uncle Joe in a nursing home. Okay? They will feel guilty about it, but unless that happens, you're going to need 2 slots in the nursing home, one for Uncle Joe and one for his caregiver. Because the caregiving is really, really rough. At that point, the patients deny there's anything wrong with them. They're often obstreperous, hostile, and violent. Even some of the nicest people you'd ever see, deacons and scoutmasters alike, will turn really nasty at this point. And it's not their fault, but it's really rough caregiving. You need to give respite, and you need to help people get Uncle Joe into a nursing home. If you can afford it, the best possible thing is to put a big fence around your house and have 24-hour care for Uncle Joe. But most people can't. And if you can't do that, just bite the bullet and put Uncle Joe in as nice a place as you can, because you're going to end up there yourself if you don't. Okay? In the nursing home, Uncle Joe's not going to be happy. He may not remember where home is, but he won't like it. He will know this isn't it. Nonetheless, that's the place to be. In the first couple of years in the nursing home, he will become progressively mute. He will begin to forget how to feed himself. He will begin to forget how to talk. He will begin to forget how to walk, how to do anything. And in the end, at about the 8th year on average, he will curl up in the same fetal position he came into the world, and mercifully he'll die. Usually the cause of disease or the cause of death is bed sores or systemic infection from bed sores or pneumonia, the old man's best friend. But these wouldn't have happened if the patient wasn't in a semi-comatose state with Alzheimer's disease. So more and more physicians have come to start listing the cause of death, not as sepsis or as pneumonia, but as Alzheimer's disease. And as they've done that, we've come to recognize just how common a cause of death it is. The Alzheimer's Association says it's the 6th leading cause of death in the United States. I think that's probably an exaggeration, but it is very much up there. Yes. Anybody else? Oh, yeah, just get over here.
Assuming that the new SRI drug pans out, do you see people taking it preventatively, like with their morning vitamins, or only after diagnosis?
Absolutely. I think the future for any Alzheimer's drug is going to be prevention, not treatment. There's just no way we're going to, you know, my hope is at least that this drug might halt Alzheimer's disease, but it's not going to reverse it. Not going to reverse it.
Okay.
Yes, ma'am.
Do you think migraines are a risk factor for Alzheimer's disease?
There are a couple of papers that suggest it is. There are a couple of papers that suggest it isn't. My guess is it isn't.
Do you think it's the inflammation linked to it?
That inflammation is related to it? To migraine? I don't know. I'm not an expert in migraine. Yes?
In the beginning, you mentioned that 80% of dementia was Alzheimer's. What's the basic other cause of dementia besides Alzheimer's?
So Wernicke-Korsakoff's chronic alcoholism in an elderly person causes memory problems like Alzheimer's. Jakob Creutzfeldt, that's another one. There are many exotic ones like Pick's disease, Niemann-Pick's disease, frontotemporal dementia, et cetera, but they're all relatively minor compared to Alzheimer's.
Okay, so they have just minor symptoms compared to the forgetfulness.
No, they have full bore. They can have full bore dementia that's just as bad as Alzheimer's and looks a lot like Alzheimer's. But when you look at the brain at autopsy, the pathology is completely different. They don't have amyloid deposits, for example.
Okay, thank you.
Talk about prevention. I've recently been introduced to some literature that suggests that diet can be a preventive.
Well, diet, so a couple of things. I mean, diet can, if it helps your circulation, absolutely. I think that will be helpful in preventing Alzheimer's disease, no question. Anything that you do for your heart will be good for your brain, okay? If you're protecting your heart from plaque, that's a good thing. That will protect your brain. Eating particular foods only in the sense that they help improve vascular function and efficiency, yes. But you know, don't tell me that Brussels sprouts are going to cure Alzheimer's disease. It ain't going to happen. Yes.
Do you know what vascular dementia is and how that relates to? My dad's supposed to has been told to have vascular dementia and not Alzheimer's. So what's the difference?
So vascular dementia has all the same symptoms pretty much as regular Alzheimer's disease. When we look at the brain of a patient with vascular dementia, they most often have just as many amyloid deposits, just as many neurofibrillary tangles. But there's certain dissimilarities. They tend to have more neurofibrillary tangles. They tend to have more pathology in the frontal lobes and tend to have more problems with executive function than they do with memory. So judgment, they exhibit very poor judgment. And they will have some short-term memory problems, but not perhaps, and again, there's a lot of variability, but somewhat less than in standard Alzheimer's. Still, the pathology is quite similar, quite similar, and probably the origins of the disease are quite similar.
And the life expectancy is similar as well?
Probably about the same, but again, there's huge variability.
Right. Thank you.
Yes?
You talked for a while about people reaching the end of their rope and not remembering how to eat and not remembering how to walk and reduced to a fetal position. Many people have medical directives, do not resuscitate and so forth. Probably by the time one gets to that stage, one doesn't want to particularly be alive. There's not much joy in life. What would you put in a medical directive or to simply not provide care for somebody like that?
Well, I have it, you know. If I have a do not resuscitate. The problem is you can't say just because I'm unable to speak, you need to off me, because nobody's able to do that. It's just not considered ethical. I'm not sure I would mind it being ethical, but it's just not done. I don't know what to say. If I had terminal Alzheimer's disease, once I reach the point where I don't know who my wife is, I want somebody to put a bullet in my head if at all possible.
I've heard people say that you cannot have antibiotics administered and you die of an infection. No feeding tube.
Yeah, yeah. There you go. Yeah, that's good. Thank you. Yes, sir.
I saw a pamphlet at the Alzheimer's Association about 10 years ago, and one possible cause, I think, was something to do with the thyroid. Is there any connection that you know of?
I mean, like I said, you can find a connection with almost anything, and if it was found, it was probably hyped by the medical school at which it was found and appeared in the papers. But a lasting legacy for thyroid conditions and Alzheimer's, no.
Okay, thank you.
Yes, sir.
Could you comment on the reliability of spinal fluid tests in the diagnosis of Alzheimer's?
I didn't get the last part. I'm hard of hearing.
The use of spinal fluid assays
Biofluid assay?
as a diagnosis. Spinal fluid.
Oh, spinal fluid assay. Yeah. So that's a very good question too. So Elan Pharmaceuticals, in addition to this A-beta immunization therapy, they also did something I thought that was very good, and that is they were leaders in analyses of spinal cord fluid. You know, you can stick a needle in your spinal cord. It's not very fun, but it's done all the time in Europe especially. Withdraw spinal fluid, and it was found that low levels in the spinal fluid of amyloid and high levels of tau were a pretty good diagnostic for Alzheimer's disease. The theory was that all the amyloid was bound up in the brain so it couldn't get into the spinal fluid. That's why it was so low. But for some reason, tau does get into the spinal fluid and the high level. So if you had both of those together, you could use that as a laboratory diagnostic, and it was about 85% accurate. Of course, a good neurologist just doing memory tests is about 90% accurate. So there is some question about whether or not you would want to go to the expense of having that, but I would. Any piece of information that you can get would be good. Yes, ma'am.
Does the incidence of Alzheimer's disease vary by groups of people, such as race or different countries?
Great question. Does the incidence of Alzheimer's disease vary among ethnic groups or different groups? As I said, Alzheimer's is very democratic and Republican disease. It happens to almost everybody. About once or twice a year, I read a paper that says that some tribe in Africa doesn't have as much Alzheimer's disease as the rest of us. And my immediate response is that tribe in Africa doesn't have doctors who know the difference. Okay? So that's the most usual explanation. However, there have been some fairly careful studies in India that suggest that there are certain groups of people in India who have less Alzheimer's disease, and some have attributed that to curcumin, or this ingredient in curry. So there may be something there, but to my knowledge, it really hits everybody about equally. Alice.
Okay. Thank you very much, Joe. That was really a very informative and extraordinary presentation delivered with tremendous grace and charm and humanity. So thanks very much.
Thank you. And thank you for putting it into it. I just felt the hook. Thank you.